Right now, before I say another word, I want you to do something. Go to a mirror or simply run your hand through your hair and take a good, honest look at it. Look at how thick or thin it is. Look at whether it's been falling out more than usual, on your pillow, in your brush, in the shower drain. Look at its texture. Is it dry, brittle, coarse, or has it changed? And look at where any thinning is happening, all over, or in patches, or at the temples. Because your hair, which most people think of as purely a matter of appearance, is actually one of the most sensitive indicators of your inner health that you have. Your hair can quietly reveal warnings about your thyroid, your iron levels, your nutrition, your stress, your medications, and more. And it often shows these things months before you'd notice them any other way. Now here's what I want you to understand today. Some of the hair changes you'll see after 60 are completely ordinary and harmless, just the natural aging of your hair, and I'll reassure you clearly about those so you don't worry over nothing. But some hair changes, and I'll be honest with you about exactly which ones, can be a genuine early warning of something in your body that deserves attention, and almost all of those causes are treatable once found. And there's one particular pattern of hair loss, near the end, that people almost always blame on aging, when it's actually a sign of something completely fixable. So whatever you do, don't stop watching before we get to that. So keep that mirror handy, and let's read your hair together. Let me start by explaining why your hair reveals so much, because once you understand this, every sign makes sense. Here's the key fact. Hair is one of the fastest growing tissues in your entire body, and growing it takes a surprising amount of resources, protein, iron, vitamins, minerals, and energy. But here's the crucial part. From your body's point of view, hair is a luxury, not a necessity. Your body doesn't need hair to survive. So when your body comes under strain, when it's short of iron, short of protein, when the thyroid slows, when you're seriously stressed or ill, your body does something very sensible. It diverts resources away from the luxury of hair and toward the essentials, your heart, your brain, your organs. And the result shows up in your hair. It thins, it sheds, it becomes brittle, it stops growing well. So your hair is like the canary in the coal mine of your health. It's often the first thing your body sacrifices when something is wrong, which is exactly why hair changes can be such an early warning. And there's one more thing to understand. Hair grows in cycles. Each hair grows for years, rests, and then sheds. And because of this cycle, a shock to your system often shows up in your hair 2 to 3 months later, so the hair you're losing today may be telling the story of what your body went through a few months ago. So your hair reveals so much because it's a fast-growing luxury tissue your body sacrifices first under strain. And its cycle means today's hair reflects your health from months back. Now let me take you through the signs, starting with what's completely normal. Let me first reassure you about the normal changes, because most of what you see is ordinary aging. As we age, our hair naturally changes in several ways, and none of these, on their own, mean anything is wrong. First, it thins gradually. The individual hairs become finer, and the total number of hairs slowly decreases, so hair that was once thick becomes thinner over the decades, gradually and evenly. Second, it grays, as the pigment cells in the follicles slow down and stop, which is purely cosmetic and tells us nothing worrying about your health. Third, it becomes drier and coarser, because the oil glands in the scalp produce less oil with age. And fourth, it grows more slowly. In men, there's also the familiar pattern of male pattern baldness, the receding hairline and thinning crown, which is genetic and hormonal. And in women, a gradual thinning over the top of the scalp. Female pattern hair loss is also common and largely genetic. So gradual, even thinning, graying, dryness, and slower growth are the normal story of aging hair, and pattern baldness is genetic. None of these are warnings. But now, let me show you the changes that are different, the ones that carry a message, and the first is the most important of all. The first warning sign is sudden or excessive shedding, hair coming out in handfuls. There's a big difference between gradual thinning over years, which is normal, and a noticeable increase in shedding over weeks or months. Hair covering your pillow, filling your brush, clogging the shower drain, coming out in your hands when you wash it. We all shed hair every day. Losing 50 to 100 hairs daily is normal. But when the shedding clearly steps up, that's your body telling you something happened. This kind of diffuse, increased shedding, doctors call it telogen effluvium, is your hair responding to a strain on your system. And remember the delay I mentioned? It typically shows up 2 to 3 months after the trigger. The common triggers are a significant illness or infection, a surgery or hospital stay, severe stress or emotional shock, like a bereavement, rapid weight loss or crash dieting, certain medications, and, importantly, the deficiencies and conditions I'm about to cover. Here's the reassuring part. This kind of shedding usually stops, and the hair regrows once the cause is addressed, because the follicles aren't destroyed, they've just been pushed into resting. But the important part is finding the cause, because sometimes that shedding is the first visible sign of a deficiency or condition that needs treating. So sudden or excessive shedding, distinct from gradual thinning, is a signal that something strained your system 2 to 3 months ago, and it's worth working out what. And that brings me to the most common hidden causes. So let me give you those, because they're the treasure here. They're the fixable ones. The second sign points to one of the most common fixable causes of hair loss in older adults: low iron. Iron deficiency is one of the most frequent causes of hair thinning and shedding, especially in women. And here's why. Your hair follicles are among the most iron-hungry tissues in your body, and when your iron stores run low, the follicles are among the first to be cut off. And here's the trap. You can have low iron stores, enough to affect your hair, before you're anemic enough for it to show up as obvious symptoms. So the hair loss can be the first clue. The signs that go along with it: tiredness, weakness, breathlessness, pale skin, brittle or spoon-shaped nails, and restless legs. Low iron in an older adult always deserves a doctor's attention, not just an iron pill, because the cause of the low iron needs finding. Sometimes it's diet, but sometimes it's slow blood loss from the gut that needs checking. So unexplained hair shedding plus tiredness or paleness should make you think of iron, and it's found with a simple blood test, and treating it genuinely regrows hair over months. Now let me give you the next big hidden cause, and this one is the great masquerader. The third sign points to your thyroid, and this is one of the most important connections of all. Your thyroid, that small gland in your neck, sets the pace of your entire body, including your hair follicles. When the thyroid is underactive, which is common after 60, especially in women, everything slows, and the hair follicles slow with it. The result is hair that thins all over, becomes dry, coarse, and brittle, and sheds more. And here's a very specific clue doctors look for: thinning or loss of the outer third of the eyebrows. If your eyebrows have faded away at the outer edges, that's a classic thyroid sign. The other symptoms that go with an underactive thyroid: feeling tired and sluggish, feeling cold when others are comfortable, weight gain, dry skin, constipation, and low mood. An overactive thyroid too can cause hair loss, with fine, soft hair that sheds, along with feeling hot, anxious, and losing weight. The wonderful news: thyroid problems are found with a simple blood test and are very treatable, and the hair recovers with treatment. So thinning, dry, brittle hair, plus tiredness, feeling cold, and thinning outer eyebrows should make you think thyroid. And it's a simple test. Now let me cover nutrition, because after 60, this matters more than people realize. The fourth sign points to your nutrition, and particularly protein. Remember, hair is made of protein, keratin, and growing it requires a steady protein supply. And here's the reality of later life. Many older adults quietly slide into eating less protein. Appetite fades, cooking feels like effort, meals become tea and toast, and the body, short of protein, cuts off the luxury of hair first. The result is thinning, weak, slow-growing hair, and often at the same time, the loss of muscle and strength that protein shortage also causes. Beyond protein, deficiencies in zinc, vitamin D, and certain B vitamins can contribute to hair problems, and crash dieting or rapid weight loss is a classic trigger of major shedding. So thinning weak hair in someone eating poorly is often a nutrition signal, and the fix, a genuinely adequate diet with protein at every meal, helps not just the hair but the muscles, bones, and energy too. And I'll add one caution here. Be careful with megadose supplements, because more is not better. In fact, too much of certain supplements, and this surprises people, can itself cause hair loss. So aim for a good diet and doctor-guided correction of proven deficiencies, not fistfuls of pills. Now let me cover medications, because this is the cause hiding in plain sight. The fifth sign is hair loss caused by medications, and this catches so many people out. A surprising number of common medications can cause hair thinning or shedding as a side effect. And because the shedding starts 2 to 3 months after starting the drug, people almost never connect the two. The common culprits include some blood pressure medications, particularly beta blockers, blood thinners, cholesterol medications in some people, certain antidepressants, some arthritis and gout medications, and others. So if your hair loss began a few months after starting a new medication, that's genuinely worth mentioning to your doctor, who can consider whether the drug could be contributing and whether an alternative exists. But, and I say this every time because it matters, never stop a prescribed medication on your own, because the medication is usually doing an important job. Take the question to your doctor instead. So hair loss starting 2 to 3 months after a new medication is a clue worth raising, but never act on it yourself. Now let me cover the patchy kind of hair loss, because it's different from everything above, and then the sign I promised you. The sixth sign is hair loss in distinct patches, which is a different matter from overall thinning. If your hair is coming out in round, smooth, coin-sized bald patches, rather than thinning evenly, that's a specific condition called alopecia areata, where the immune system mistakenly attacks the hair follicles. And it deserves a doctor's assessment, because treatments exist and because it occasionally travels with other immune conditions like thyroid disease. If a patch of hair loss comes with a scaly, itchy, or inflamed scalp, that can be a fungal infection of the scalp or a skin condition, both treatable. And any patch of loss where the scalp itself looks scarred, shiny, red, or abnormal deserves attention, as do any sores or scabs on the scalp that don't heal. Remember, the scalp is skin too. It gets decades of sun exposure, and skin cancers can hide in thinning hair, which is one more reason to have unexplained scalp changes looked at. So patchy loss, an inflamed or scaly scalp, and any non-healing scalp sore all warrant a doctor's look. They're different from ordinary thinning. And now, here is the sign I promised at the start, the one everyone blames on age when it's actually fixable, so pay close attention. Here's the pattern people almost always get wrong. A woman in her later years notices her hair steadily thinning, shedding more, becoming dull and lifeless, and she sighs and says, "Well, that's just what happens at my age," and she accepts it, buys volumizing shampoo, and never mentions it to a doctor. But here's what the evidence actually shows. When older adults with new or worsening hair loss are properly checked, a large proportion turn out to have something specific and treatable: low iron, an underactive thyroid, low vitamin D, inadequate protein, a medication effect, or the after effect of an illness. The just old age explanation is real for gradual, slow change, but new, noticeable, or accelerating hair loss usually has a reason. And most of those reasons can be fixed, and when they are, the hair genuinely improves over the following months. So the sign people wrongly surrender to is accelerating hair loss dismissed as aging, when a simple set of blood tests, iron, thyroid, vitamin D, and a medication review would find a fixable cause in a great many cases. Please don't accept it without checking. Now let me pull this together into what to do. Let me give you the practical steps. First, feed your hair, which means feeding your body properly, protein at every meal, eggs, fish, meat, dairy, beans, because hair is built from protein, plenty of fruits and vegetables for the vitamins and minerals, and enough overall food, since undereating is a hidden cause of shedding in older adults. Second, be gentle with the hair you have. Older hair is finer and more fragile, so avoid harsh treatments, tight pulling styles, excessive heat, and rough brushing, and use a gentle shampoo and conditioner, washing as often as your scalp needs, but handling it kindly. Third, protect your scalp from the sun, especially where the hair has thinned, with a hat or sunscreen, because a thinning crown takes real sun damage, and check your scalp now and then for any sore or spot that doesn't heal. Fourth, and this is the important one, if your hair loss is new, noticeable, or accelerating, get the treatable causes checked. Ask your doctor for the simple blood tests, iron and ferritin, thyroid, vitamin D, and a general check, and review your medications with them, because this is where the fixable causes are found. Fifth, manage the whole body factors, stress, sleep, and any recent illness, knowing that shedding after a shock usually recovers on its own over months once the cause has passed. And sixth, be very wary of miracle hair products and megadose supplements. Most are a waste of money, some are harmful, and the real wins are in the boring places: iron, thyroid, protein, and patience. So feed your hair, handle it gently, protect and check your scalp, get the blood tests and medication review for new loss, manage stress and illness, and skip the miracle cures. Now let me be clear about when to see your doctor. Let me be very clear about when your hair is a reason to see your doctor. See your doctor for new, noticeable, or accelerating hair loss or shedding, because the treatable causes, iron, thyroid, vitamin D, nutrition, and medications, deserve checking. Don't just accept it as age. See your doctor if hair loss comes with other symptoms: tiredness, feeling cold, weight change, paleness, or brittle nails, which point toward thyroid or iron. See your doctor for hair loss in distinct patches, for a scaly, inflamed, or painful scalp, and, importantly, for any sore, scab, or spot on your scalp that doesn't heal, which needs checking like any skin lesion. And see your doctor if hair loss began months after starting a new medication, so it can be reviewed, never stopping anything yourself. So new or accelerating loss, loss with symptoms, patchy loss, scalp changes, non-healing scalp sores, and medication-timed loss all warrant a doctor. Getting checked is quick. It's usually a blood test, and it very often finds something fixable. Let me paint you a picture of how this plays out. Picture a woman in her early 70s whose hair has been shedding heavily for months, her ponytail half its old thickness, and she's quietly grieved about it and accepted it as age. But because she learns that new hair loss usually has a findable cause, she asks her doctor to check, and the blood tests tell the story. Her ferritin, her iron stores, are very low, and her thyroid is mildly underactive. Her doctor treats both and looks for and finds the cause of the low iron. And over the following months, slowly, because hair takes months, the shedding stops, new growth comes in, and her hair genuinely recovers much of its body. What she had surrendered to as aging was two simple, treatable deficiencies. And picture the other man who, at his wife's urging, has a crusted spot on his thinning crown checked, and a small skin cancer is caught early and removed simply, because someone thought to look at the scalp. That is exactly what reading your hair and acting on it can do. And let me speak briefly to those of you caring for or close to an older person. You can help by noticing their hair and taking seriously any new or heavy shedding, patchy loss, or scalp sores, and gently encouraging them to get the simple checks: iron, thyroid, vitamin D, and a medication review, rather than surrendering to it as age. You can help them eat enough protein and good food, since quiet undereating is such a common hidden cause. You can help check and protect their scalp, a hat in the sun, and a look now and then at spots they can't see. Helping a loved one act on hair changes can uncover a fixable deficiency, ease a real sadness, and occasionally catch something on the scalp that matters far more. Let me draw this all together. Your hair is one of the most sensitive early warning systems your body has, because it's a fast-growing luxury tissue that your body sacrifices first when something is wrong, and because its growth cycle means today's shedding tells the story of your health from 2 to 3 months ago. Gradual thinning, graying, and dryness are the normal story of aging hair. But sudden or excessive shedding is a signal, and its most common hidden causes, low iron, an underactive thyroid, inadequate protein and nutrition, medications, illness, and stress, are almost all findable and fixable. Patchy loss, scalp inflammation, and non-healing scalp sores are separate signs deserving their own attention. So here's what I'll leave you with. First, understand that hair is a health signal, not just a cosmetic matter, and that new or accelerating loss usually has a reason. Second, know the big fixable causes: iron, thyroid, protein, vitamin D, and medications, and get the simple blood tests rather than surrendering to age. Third, feed your hair with real food and protein, handle it gently, and protect and check your scalp, including for sores that don't heal. Fourth, remember the 2 to 3 month delay. Today's shedding reflects a strain months ago, an illness, a stress, a new medication, which helps you and your doctor find the trigger. And fifth, see your doctor for new, heavy, or patchy loss. Loss with tiredness or feeling cold, scalp changes, or any non-healing scalp sore. Your hair has been quietly reporting on your health your whole life, and now you know how to listen. So take care of yourself, feed and protect that hair, get new changes checked, and don't accept as aging what might be a simple, fixable deficiency. And because finding the cause needs a doctor's tests and judgment, please treat new or accelerating hair loss, or any scalp concern, as your reason to see your own physician, rather than grieving it in silence. If this helped you, please give it a like and subscribe, because I share this kind of clear, practical guidance for older adults every week, and I'd love for you to keep watching with me.